Today, a decade-long battle over Medicaid ended with an agreement to expand it, meaning 500,000 people in North Carolina who do not have health insurance right now will soon be able to get it. WRAL Capitol Bureau Chief Laura Leslie joins us now live with how lawmakers decided now was the time to get this deal done. Laura, a huge deal.
Lena, it was the extra money on the table that got him there. The state stands to gain an extra nearly $2 billion from the federal government, and that money would go to rural hospitals if they get Medicaid expansion passed by June 30th. Leaders said today that money was just too good to pass up.
House Speaker Tim Moore said he and Senate Leader Phil Berger haven't worked out all the details yet, like when the expansion will take effect, but they've agreed on the basic terms.
We're going to have a policy that is going to expand access to working North Carolinians, that is going to ensure that there is a more robust supply of a lot of these services, that is going to result in less cost.
The deal will expand Medicaid coverage to people making up to 133% of the federal poverty level. That's up to $30,000 a year for a family of 4. Most are working families who just don't make enough to pay for health care.
This is a momentous day for North Carolina.
State Health Secretary Cody Kinsley has been working toward this for years. He says it's especially good news for rural areas where people are more likely to be uninsured and where hospitals are struggling to stay open.
On healthcare businesses that are trying so hard to stay in business, to serve their communities, but 30 to 40% of the people walking through the front door don't have a way to pay. Medicaid expansion is going to change that.
Overall, Medicaid expansion plus the additional federal funding for hospitals will bring in $8 billion a year. North Carolina would also get a $1.8 billion bonus this year.
The signing bonus is tied to a provision that the federal government passed to sweeten the deal for the states that have not yet expanded Medicaid.
UNC public health expert Dr. Ciara Zachary has been waiting for this day for a long time. She said expansion will have ripple effects for the whole state, not just the 500,000 people who will gain coverage.
I think this just isn't about providing health care. This is about strengthening our hospitals. This is about getting a healthy workforce. And this is about investment in our North Carolina communities.
Now, Governor Roy Cooper, as we know, has been pushing lawmakers for years to expand Medicaid, and he praised today's news. But there is a political catch here. Berger and Moore said that expansion is dependent on the passage of the state budget, and that leaves Cooper very little leverage to veto it.
We'll have to see what's in the state budget now. Laura Leslie reporting live for us. Thank you.